The Neonatal Intensive Care Unit is the place for new babies who aren't ready to go home from the hospital and their mothers.
That's right. The NICU at GBMC provides expert care and compassion for those patients that need it the most. And I got a chance to check it out for myself.
Aww.
Take a look. We're chatting today with Dr. Howard Birenbaum, the Director of Neonatology here at GBMC. Thank you so much for having us.
Thanks for visiting with us.
Of course. So tell us about this new NICU space that was just opened.
So our NICU is brand new. It opened at the end of June, and it is a tremendously wonderful NICU. It's been a very long time in coming,
yes.
But it provides an opportunity to provide really individualized care for babies and for their families. One thing that sometimes people don't think about is that we care not just for the baby, but for the larger family, and this unit helps to make that happen.
Yeah, and tell us about some of the people who work here to help make that happen.
Well, primarily it's going to be the nursing staff who are typically at the baby's bedside, and they provide the real expertise that helps the neonatologists, who are specialists in taking care of small and sick preterm infants. We work with a very dedicated team of other physicians, neonatal nurse practitioners and physician's assistants, in addition to a whole host of therapists that are involved in caring for the baby, from speech and language pathology to occupational therapy, social work, among others.
That's great. And as you saw, we just passed by these monitoring devices. Tell us about why it's important that they're outside the rooms now.
Okay. So in our old NICU, we had everything take place pretty much inside the patient room. Right. Having monitors outside the room and having nursing substations allows the bedside nurse to be able to see the baby's vital signs from outside the room, can do a lot of the charting from outside the room, and avoids a lot of interruption, and also provides a lot more privacy for the families who are with their babies.
What is kangaroo care? Tell us about that.
Kangaroo care is something that's been around for a while, and it's a way of having the baby be directly on mom's and sometimes dad's chest, skin-to-skin care. And it's a very good thing to do because it allows for lowered stress levels in both mom and baby, helps with breast milk production, regulates baby's heart rate, and promotes growth and development. So it's an important thing to do. So we encourage that from the smallest babies to the largest babies.
Oh, they're so cute. So speaking of parent involvement, tell us a little bit more about what you do in terms of helping them. How do you prepare them for the day that baby comes home?
Well, we have a tremendously dedicated nursing staff that works very closely with the families, and we basically begin for discharge on day one. So we have a pretty good process for the things that need to get done prior to discharge. And at the day of discharge, the nurses review with the families all the things that they're going to need to do when they go home. Sure. Importantly, we want to see the families make appointments with their private pediatricians 1 or 2 days typically after discharge, so they can have a baseline assessment in their offices.
That's wonderful. So why should people choose the NICU here at GBMC?
Well, we're a community hospital. I think we're a very good community hospital. Our NICU prides itself on personalized care. We also practice an evidence-based neonatal practice, and I think that is very important in terms of delivering the best care available to our vulnerable newborns. If you'd like more information, www.gbmc.org, and you can link to the NICU from that website.
Perfect. Thank you so much, Doctor.
You're very welcome.